Good morning, everyone.
Good morning.
Thank you all for coming. We have a great turnout here this morning. So my name is Dominick Stanzione. I'm the President and Chief Executive Officer here at Brookdale. I'm also the Chief Operating Officer of the new One Brooklyn Health System. So as many of you know, this is a very exciting time for this community with the coming together of One Brooklyn Health, as well as the Governor's Vital Brooklyn Initiative. One of the principal tenets of this, of One Brooklyn Health is really to come together in partnerships. Our three hospitals, Brookdale, Kingsbrook, and Interfaith coming together to provide better care for the community, but also partnering with other community providers and folks who are also serving the same mission that we're serving here at Brookdale and within One Brooklyn Health. A very important partner, a very strategic partner of ours is SUNY Downstate. We work closely with SUNY Downstate on a number of initiatives, and this is one of them that we're going to be talking about today. This is very important in terms of the needs of this community and bringing together resources of a number of organizations to better serve the folks in the community who need those services. So with that, it's my pleasure to introduce Dr. Riley, the president of SUNY Downstate.
Great. Thank you, Mr. Good morning. I want to thank Dominick for his great leadership in Brooklyn and improve the health of all of Brooklyn. We are very excited to be here this morning to launch this great program, this STAR treatment clinic at Brookdale in cooperation with SUNY Downstate Medical Center. Just a few tidbits I'd like to share why this is impactful. Today's ribbon cutting highlights the fact that the STAR program has received 3 grants totaling $7.7 million to take care of HIV patients. Colleagues, that is outstanding to get almost $8 million to take care of Brooklyn citizens. So specifically, this specific grant, the largest of which is through the Ryan White program of approximately $3.3 million, will allow us to expand care coordination, mental health, and substance abuse services at the STAR Health Center here. This STAR Health Center is a primary care clinic for adults with or at risk of HIV. It will be located, co-located in both University Hospital Brooklyn and here at Brookdale Hospital and Medical Center. Again, this $3.3 million will last for 2.5 years, and it comes from the Ryan White Part A Care Coordination Program for the City of New York. Now, we've had Ryan White money previously, but this is a significant increase. And this increase in Ryan White funding will allow us to expand a number of services to HIV patients to improve their care coordination, again, for patients who have or at risk of HIV. And it will be right here at the Brookdale site. Now, the reason why care coordination is so important is that we know we lose some HIV patients because they just lose their primary care provider, they just get frustrated or tired dealing with their disease. But this care coordination program will re-engage those with HIV and AIDS who have been lost to follow-up. We'll bring them back into consistent medical care and self-directed health promotion activities. Again, getting them to invest in their quality of life and taking care of themselves through the work with this clinic. The primary strategy is, again, vigorous, strong medical case management, and that means frequent assessment, frequent visits with a healthcare provider or physician, developing a treatment plan, modifying that treatment plan as conditions change for the patient. Another key aspect that I really love is the fact that patients who get involved with this STAR Health Center will be assigned to a patient navigator. A patient navigator is someone who will work with you, who will hold your hand, if you will, to deal with your disease and also how to manage your disease. They'll make home visits. They will come with you to the appointments here at the health center if you need someone to accompany you. They'll offer ongoing emotional support, education about the disease, and in some cases they will perform what we call directly observed therapy, where they will stand right with you as you take your medications to manage your disease. So again, this is something we have been involved in for 32 years at SUNY Downstate. We began first taking care of patients in a coordinated fashion back in 1985 during the earliest days of the HIV/AIDS epidemic. And that got expanded in 1989 when we not only did the testing and the treatment, but we also began to do supportive counseling and other services to improve the health and welfare of HIV patients. This is a multidisciplinary HIV care team that will be composed of nurses, physicians, social workers, patient navigators. As I was saying, the Special Treatment and Research Program, our STAR program, is multidisciplinary. It's not just physicians, but nurses, PAs, social workers, patient navigators, who will really embrace the care of their patients who will present to this great clinic. Now again, this collaboration is a result of the New York State Department of Health study performed by Northwell that said, look, we need to better coordinate the care of HIV patients in Brooklyn. So again, this is a strong program that will allow us to go from 1,200 patients treated to well over 2,500 patients treated. So again, this is how impactful. We will be able to touch 500 more individuals with great state-of-the-art HIV care and support. Again, we could not do this without the strong support of One Brooklyn Health. Dominick Stanzione, a distinguished graduate of Downstate, I should mention, who is both the CEO of Brookdale and the COO of One Brooklyn Health. Dr. David Rose, the Chief Medical Officer, thank you for your leadership, Dr. Rose. The entire Brookdale team that are here, the entire SUNY Downstate team who are here as well, and the manager, Hillary Farmer. These are the folks who have done the outstanding work to get to this day. Personally, I'd like to thank one of our great clinicians, a distinguished professor of medicine and infectious disease who leads the STAR program, and that's Dr. Jack DeHovitz. If there's anybody in this part of the world who is passionate about making sure that patients with or at risk of HIV get the best care, it's Dr. Jack DeHovitz. And Jack, I want to thank you for your great leadership all these years. Again, this is a great day in Brooklyn, colleagues, because anytime we can make a difference in the patients' lives with HIV or at risk of HIV, we are doing the community a good service. So thank you very much. I'm delighted that we at SUNY Downstate are here. We will continue to be here, and we will continue to advance the health care of all of Brooklyn. Thank you very much.
Thank you, Dr. Riley. It's wonderful for us to partner with you and to, with your help, to really bring this to the next level. And thank you for being here in Brooklyn. Your leadership is really going to help bring Downstate to the next level. So we appreciate that and look forward to working with you. So it's my pleasure now to introduce Dr. DeHovitz. As Dr. Riley said, he's had Alika Samuels is here, joined us. So Dr. DeHovitz has had a tremendous impact not only on this community but internationally. He's internationally known for his expertise in this area, in bringing grants that help folks to develop these programs and make a huge difference in the lives of individuals. So Dr. DeHovitz.
Thank you so much, Dominick. Thank you all so much. First, I'd like to thank the organizers of today's program, namely Kari Edwards and Dawn Skeet Walker, who's really helped us get us to where we are today. Dr. Riley spoke a little about STAR, and just to reinvigorate that, Special Treatment and Research Program, STAR, was formed in 1991, focusing on outpatient HIV care to adults. And over the years, we've really expanded dramatically to include mental health, substance use treatment, hepatitis C screening, and specialized care for LGBTQ populations. Obviously, we've received multiple citations for our high-quality care, and all of our activities are guided by our community advisory group. Of course, as Dr. Riley mentioned, this has really been supported a great deal by our external funders, including the NIH, HRSA, SAMHSA, as well as University Hospital. And I'm thrilled to see so many people from University Hospital here today to support us, because it's really through them that we've been able to get to where we are today. Our global reach, as Dominick spoke to, has allowed us to train hundreds of physicians and research investigators in Central and Eastern Europe, as well as the Caribbean and South Africa. And finally, even though our close relationship with TLC is enhanced today, we've been working with them for many years through our AIDS Education and Training Center, ensuring that the quality of care is where it needs to be. We're thrilled to link up with One Brooklyn Health System, and while orthopedics served as the catalyst with support from the Dean's Office, a real vision was laid out about a year ago for expanding the linkages, subsequently laid out what we see today. Dr. Rose, Chuck Salvo, and Joe Chastani, all of whom are here, were really critical in helping us get to this, and it was the collaboration was really enhanced once Dominick Stanzione came by and Wayne Riley joined our institution. Dr. Riley spoke about our accomplishments, and even though we've only been working here for a little less than a year, as we heard, we've already got this $3.3 million grant. We've established a training site here for physician assistants from SUNY Downstate. We've linked with other STAR programs, including harm reduction and hepatitis C services, and we're about to launch a dramatic expansion of post-exposure prophylaxis and pre-exposure prophylaxis. Additionally, we're going to be working with many other departments here, including psychiatry, obstetrics, and emergency medicine, and ambulatory care. In closing, I want to just extend my deep gratitude to Ellen Honey, the STAR Program Administrator, and Jessica Yeager, who's somewhere here, who've really been working tirelessly with the STAR Brookdale staff to make this the best place for individuals with HIV. I also, of course, want to thank Brookdale leadership, including Mr. Bafilko, Oksana Kotlarski, and Hillary Farmer, with all the Brookdale staff who've helped bring this to fruition. And finally, thanks to all the community partners and funders who attended today to show their support. Thank you very much, and we're looking forward to great things here.
Thank you, Dr. Hovitz. And I mentioned earlier that we share a common mission with SUNY Downstate and our community partners. None of us would really be able to function without the strong support of our elected officials, and we have a very important one here today. So I'd like to acknowledge and welcome Council Member Alika Samuels with us. Would you like to say a few words?
Good morning, all.
Good morning.
It seems like whenever I stand at a podium, I'm always telling a real story. This community is full of real-life stories related to every topic of discussion that's media-worthy. As we get ready to cut the ribbon on the STAR Program's dedicated center, which will enhance services providing HIV/AIDS support, allowing our families and loved ones to live longer, healthier lives, I think about my father, who was HIV positive, and the young, vibrant man with addictions he could not beat. He died on October 29th in 1991. I then think about my Uncle Sam, who we watched lose his battle, dying of complications related to AIDS in June of 1993. And then I think about February of 1998, when I lost my other Uncle Larry, who passed away to complications related to AIDS. We've heard the statistics and numbers. New York City was the site of one of the first documented AIDS cases in early 1980s. Then the epidemic peaked here around 1993, with an estimated 14,000 AIDS-related deaths, my Uncle Larry being one of them. Well, that was then, and this is now. Today, the rates are significantly lower, and many people are diagnosed earlier with HIV before their diseases reaches AIDS. But New York City still leads the nation in the number of new HIV cases. And girls continue to be at higher risk for HIV than boys their age. And in 2016, Central Brooklyn led the city in new HIV infections. Hospital and clinic closures in Brooklyn may have worsened the response to the epidemic, and lack of medical care prevented people from learning their status and learning about preventive measures or early treatment. But Brookdale Hospital has always been on the scene. The dedicated programs here have been successfully provided comprehensive and high-quality HIV/AIDS-related healthcare services with a feeling of community for so many years. And this new dedicated center and program will enhance Brookdale's services for the community and be able to expand on what we really need in Brownsville. With the reopening of this facility, more people will have access to the care that they deserve and need, with state-of-the-art technology, and of course, general funding, because we always need enhanced and increased funding. This clinic will surely have a positive impact on the lives of people in my community and those surrounding by helping people to live longer, healthier, and more fruitful lives. And this is to only add to the vibrancy of the Brooklyn that we all know and love, especially Brownsville. Thank you.
Councilmember, thank you for those inspired words, for your outstanding leadership and your unwavering support of our mission here. We really appreciate all your efforts. As you came in the building, you may have seen the banner of one of our important community partners. I would like to ask Ms. Bailey to come up and say a few words.
Thank you so much. Thank you, Doc. Good morning. I am so extremely proud to stand here today, because for a lot of us who've been working in this field and working with Brookdale for many years, where a lot of our partners have gone out of business, but HIV and AIDS continues to plague our community. So I don't know how, but I'm thankful that this hospital continues to lead, continues to proudly represent our community, and understanding that this is a community disease. This is not a disease that we can park at the media, leave it, come back to it every now and again. This is every single day. For over 30 years, we've been fighting this epidemic in our community. And on days like today, it tells us, people like myself, that the war is not over, that we continue to fight. We continue to keep HIV and AIDS in the forefront of the minds of our elected officials, along with our other institutions. We have everybody to thank for this day. Unfortunately, we continue. Those numbers, they project the numbers have gone down, and it's not the same. But in our community, if they look a little bit deeper, our community has not gone down. It's just that we have to work harder to get people tested. We have to work harder to let people be educated about the disease and unafraid to know their status. This is Breast Cancer Awareness Month, and I noticed the pink, and I know that it's a great thing that we're doing in this facility. But this red ribbon is every single day. AIDS has no month. AIDS is here in our community. It will stay in our community until there's a cure, and we have to continue fighting. So it is days like today that I feel rejuvenated myself as we cut this ribbon and as we continue with this STAR program. This program that has done great work, no matter what name we have on it. It has been here consistently, played an active role in our HIV care networks when we had them, played an active role in our coalitions that the Center of Disease Control did a study just particularly on this area that we participated in. This is not new for us. This is rejuvenation, this is revitalization. And I tell you, until there's a cure, Watchful Eye will be and continue to be a partner of Brookdale Hospital.
Again, thank you, Ms. Bailey. Your leadership in this community is really phenomenal. And, we're doubling our commitment to continue to work with you. So thank you very much. I'd like to ask one more person to come up and speak, really to represent the medical staff here at Brookdale, and that's Dr. David Rose, our Chief Medical Officer. Dr. Rose?
Thank you. Thank you, Mr. Stanzione, Dr. Riley, Dr. Dahovitz, and especially Ms. Samuels and Ms. Bailey for really telling us about the human impact of this terrible epidemic. So this is a wonderful moment. This is the collaboration between Downstate and Brookdale and the growing collaboration and having the STAR program rebrand itself from the program that we've had here at Brookdale is terrific. I've known Dr. Dahovitz for over 30 years. And he doesn't look it, but he was actually 30 years ago. He was a star even back then. He and I were AIDS clinicians and researchers at the beginning of the AIDS epidemic, when it was not a chronic disease the way it is today, but it was an acute disease. We didn't fully understand the virus. We didn't have good antiviral drugs at the time. We didn't realize that it really takes an interdisciplinary team to take good care of these patients. And Dr. DeHovitz stuck with it and worked on it and really created much of what we know about the management of AIDS and taking care of the people. Ms. Samuels and Ms. Bailey reminded us that this is really all about people and the families that love them and care for them, because this is an illness that impacts not just the patients but their families as well. And Dr. DeHovitz has taught us much about the management of this illness and created programs that I think are going to really help this community. So thank you all. This is a win-win-win for all of us, a win for Brookdale, a win for Downstate, and especially a win for the people of this community. And that is really what this is all about. So thank you all.
Thank you, Dr. Rose. So both Dr. Riley and Dr. DeHovitz were nice enough to acknowledge some of the other members of the leadership team from Brookdale who are here today. I'd like to acknowledge a few of the people from Downstate's leadership who are here, and can't do everyone, but a couple. So William Walsh, who's the CEO of University Hospital. Dr. Ross Clinchy, who's hiding back there someplace, Associate Dean at SUNY Downstate, and Dr. Michael Lucchese, who is the acting dean at SUNY Downstate. Mike, would you like to come up and say a few words?
Hi, good morning. I don't want to delay this anymore. This is amazing. It's fantastic that you can bring all these people together and do something for the community. I was really taken by what was said by the community leaders and our elected. So keep up the good work, and we'll do whatever we can. This is such an important cause, and thank you all for coming. Thank you.
So the infectious disease divisions of both of our institutions are under the departments of medicine, and they play a very critical role. I'd like to acknowledge Vice Chair of Medicine from SUNY Downstate, Dr. Rahman, who's here today. Would you like to say a few words?
Well, good morning, everyone. Thank you for the opportunity. I have been at Downstate for the last 18 years. I joined my career. Thank you for the comment, but appreciate it. Started early. I was an intern in the Department of Medicine when I started, and as you can imagine, I have seen my shares of patients with HIV disease and how quickly they progress to the terminal condition of AIDS. We could do very little for them. But several things that I could count on. One was vast number of our physicians who are board certified in internal medicine as well as infectious diseases. And we also could count on HIV specialists, colleagues who could assist us in caring for these patients who have very high needs in clinical, social, and psychological areas. UHB, University Hospital Brooklyn, had been at the forefront of this HIV epidemics since, as Dr. Riley, Dr. DeHovitz, everyone mentioned, since 1980s. And that, I think, became obvious when the STAR Clinic was initiated in late 1991 and 1992. We have trained at Downstate a whole generation of clinicians who are now leaders in HIV care in many parts of this country. I'm very excited to tell you that I'm here today at the beginning of this initiative and looking forward to longer and healthier lives for our patients in our community. So thank you very much from Downstate.
Thank you.
Thank you, Dr. Rahman, and thanks again, all of you, for being here today. This is a very important partnership, but as we've been reminded, this is really about this community and the people who entrust their care with us. So we always have to keep that in mind. We believe strongly that this is going to make a significant difference as we strengthen this partnership together. And we welcome all of you here, and we look forward to your continued support. And now we'll do the ribbon cutting. So.